So I think we've got 29, the numbers are going up all the time, 29 people with us at this point in time. Can I just welcome you all to this occasion where we're discussing the COVID-19 vaccines, and we want to consider the issues that it rises for us as a community. My name is Clive Saunders, and I am the chair of the Watford African Caribbean Association, and we are facilitating this meeting this evening. Thank you all again for joining in. The background to this is, of course, there's been a lot of debate going on around this. And in our community, there are clearly a range of opinion that exists around these vaccines. And there are legitimate concerns that are based on historical experiences of medical experimentation that has occurred at the expense of us, the African and the Caribbean communities. I would just mention the Tuskegee experiments that went on between 1932 and 72 as an indicative example of some of those. There's, of course, the issues that has been in the media concerning what has happened with Pfizer and the Nigerian children. And in this particular case of these vaccines, some of you may have recalled that at the early stage of this pandemic, there was some suggestion that there was going to be tested on Africans first, the vaccines. And a fundamental issue behind all of this, of course, has been the experience that I suspect all of us on this call have had of the impact of racism and discrimination on our lives. So added to that, in my view, there's been a lot of misinformation that's been around that has not helped us in the context of considering this matter. And the mainstream media is guilty, social media is guilty, and there's all sorts of things around this. So with all of that kind of context, we do want to try and explore these issues this evening. And all of you on this call are really key to us having a meaningful conversation about this. So tonight we've got a number of speakers with us with some great expertise to share with you.
He was driven out of his job.
Hello, can I ask you to just mute as you come in, please?
Campaigns by the Home Secretary, Priti Patel.
Yeah, okay. Yeah, if you could mute, please. So to carry on, though, to say, yes, we've got some great speakers with us, but tonight really is going to be about your views as much as anything else. And the way we're going to proceed is that we're actually going to start with hearing from a couple of people who want to share their views, one from the perspective that I don't want to take the vaccine, and that is Sandra Wright, who I'll come to in a moment, and one who has taken the vaccine and would want to share her experience as to this, and this is Angela Wells. We also have with us Ethel Changa, who's from the NHS vaccination team. She's their clinical advisor for the COVID-19 vaccination. She's one of those. He's not with us when I checked earlier on, but we also have Professor Jim McManus who's the Director of Public Health in Hertfordshire. We have also Dr. Musun Fopo-Hunda, who is a consultant psychiatrist that works with us here in Hertfordshire with HBFT. And last but not least, we have Dr. Itai Mutumbike, who is a consultant forensic psychiatrist working in Northamptonshire. So we are going to listen to these speakers, and please use the chat function to write down your thoughts as we go through. And after all of that, we will try and see if we can draw some conclusion from what we've been hearing this afternoon. I'm not going to say anything in detail about these people, but I think we're going to kick off, unless there are no initial questions from what I've said, with asking Sandra to come in. Oh, somebody said they're not getting a sound. We have started. Can you all hear what I'm saying?
Yes, we can hear you.
Yes.
Yeah, I was just cut off totally a minute ago. I missed
right.
half of what you said, but that's
Okay.
all right. But I'm back now. I don't know what happened.
We are recording it, so it will be available. So having said what I've said by way of background, I'm going to call on Sandra Wright, who is going to share with us why she doesn't plan to take the vaccine and her reasons for taking that position. Sandra.
Hello, everyone. Good evening. And the welcome was fine, you know, that you introduced and said you've got like expert speakers. I'm not an expert speaker. I'm a person, a lay person that just have looked at the vaccine and all the issues around it. And as you said, Clive, with the social media playing such a big role in how it is portrayed. And my view is, I don't see why we're being rushed to take a vaccine. So I've taken the stand that right now, vaccine is not for me. And there's various factors that I've considered. Why, at the beginning of the pandemic, the report that was coming out wasn't focusing on Caribbean people and, well, African and Caribbean people. And so they led most of the population from that diaspora into a full sense of security because we weren't told the numbers. Further along, we were told that we were the ones at the front line and we were dying like flies. But prior to that, when this first came out, I remember seeing the news reporting on China, and they were showing many people falling over. And within a matter of days, that disappeared, totally disappeared from the media. And that made me think, well, what's happened? There wasn't any reporting of what was going on there. Yes, China closed shop, and so the news that was coming out wasn't as often. But the thing is, if this was taking over the world so rapidly, why weren't we given more information? So I'm looking at it from a historical point of view on the reporting of the COVID-19. And then fast forward, business started rushing to come up with a plan to vaccinate X amount of people. Again, there was no data given that I saw that says this vaccine is going to work this way, work that way. It was just, we have to get a vaccine. And then in this country, Brexit played a part. And again, that was reported. We have to get this vaccine finished before Brexit happened because various things got to be put in place. So I felt that it was rushed. And the fact that it was rushed, it doesn't build confidence within me to say, this is something for me. I don't feel that is very well orchestrated to make you feel comfortable. I don't feel comfortable. And this has been going on for the last 8 months, 10 months, however long it's taken them to actually roll it out. And then when they did roll it out, it was like, you must take it, you must take it. It was like you've been marched, you've been told this is going to save your life. Now, again, with vaccine, from a layperson's point of view, you have to do many trials. They're saying, oh, it was approved, but who approved it? And I know many people that volunteered to take the vaccine. So again, I felt the reporting of that wasn't true. I felt the first set of people that took the first dose of vaccine, those were the volunteers. Again, I haven't seen any data to say these are the volunteers. So those people I felt are the guinea pigs. They are the ones that's been used for the trials until they've gone through a certain process to say this is not working or this is working, or the reporting is saying the first dose is working and we could see things happening. Again, it doesn't feel safe. And in terms of that, as you had said earlier, is how we've been treated in the the way we've been used for other targeted research. And in so doing, it just feels very unsafe. And I'm not going to be in line when the letter comes to say I'm to take it. I'm not taking it. I haven't seen any evidence to say this is going to work. And then we have what, three vaccines in the market. One, you have to take another dose in 12 weeks. One is saying you don't have to because we can guarantee you will not catch COVID. But then the science is saying, well, if you take the first dose and then you still have to follow the guidelines, you still have the social distance, all the things that's in place now, you still have to follow. And then they're saying when you get the next dose, when that spike protein starts to work, then we'll give you another dose that's going to even things out. Well, for now, you don't know how that's going to work. So I'm not going to be volunteering myself to become part of your research project. If you, down the line, if I see things have changed and how this can work and they've done more research, then I still won't consider it. Another thing that came out is like, I heard one speaker saying, why don't you give the vaccine to Cubans? Let them test it. Let them try out, not test it on people, but just to analyze what's in the vaccine. Again, that has been taken up. Cuba's developed a vaccine that is using more natural material. They don't want to look at it, but we're forced because the government has already put so much money into developing this vaccine. They can't look at anything else because it all comes down to public spending. So for all those reasons, I don't feel safe. I feel like it's a money-making thing and we can't go back. We've gone too far in it. We can't go back. We have to go with what we've got.
Thank you very much, Sandra. That's the end of that. Okay, thank you very much for that view. I think we're all, at the end of the day, going to have to make our own minds up about this. And this debate is about trying to contribute to that. And that means that we have to hear those different perspectives that there is out there. So for a different perspective, I'm going to call on Mrs. Angela Wells to share her views now as to why she has taken the vaccine and anything else you want to share with us about that. So Angela, welcome.
Good evening all. I have had the vaccine. I could not.
Sorry, Angela, we're not seeing you. Yeah, that's better. Yes. Yeah.
Okay, I have had the vaccine. I could not wait for them to come out with a vaccine for us. And behind that, my memory of my childhood was that at school, you were called to make an orderly line and go down and have your yellow fever or your polio vaccine. There was no business of you weren't having it, and I'm not suggesting that you must have it, but it was around and it saved lives. I've had the privilege of working in an isolation hospital, and I worked there and there were typhoid and there were polio cases who were now in iron lungs. There were people coming in severely ill. There were people passing away just because they weren't able to have the vaccination given to them. Now, I've had both ends of it, and I have to confess to you all that I do not like needles. And when I had the vaccine, the first vaccine, I was told when I come again, they would put me in a side room where no one can hear me. So I do not like needles. However, following on to that, when the HIV virus was rampant here, we were told you treat everyone as being positive. And in that way, you protect yourself and you protect others. So whether there's a vaccine or not a vaccine, one has to continue because you do not know who is the silent carrier, and you have to continue protecting yourself and protecting others. Now, my experience with COVID-19 is that my son contracted COVID-19 at the end of January 2021. And now I have to tell you, I would not wish it on anyone. I had a call saying, Mom, don't worry, he's all right. And I said, who is all right? Oh, Michael. He contracted, he collapsed at this entrance door in the street, just on the pavement. And he asked for help. 2 young men were passing and they laughed and said, oh, that Jamaican rum again. He does not drink. He was taken to Watford General Hospital, and there it was found that he had a saddle embolus in the lung. And if that was not enough, he contracted, anyway, he contracted pneumonia. They then found in 2 chambers in the heart, there was saddled embolus. And when I heard that I thought, I couldn't even pray. I just live on hope and pray that he was going to be all right. I would not wish it on anyone. And he's asked me tonight to say this, where he lay in the hospital after he came out of intensive care. All he saw was body bags being taken out. He saw people coming in and there were noise making, and then there was silence. Then the bed was empty. He saw where husband and wife came in, wife died, and the doctors came to tell the husband of their death. And he said, you could not help but hear because they did not say it silently. He said, and after he said all that to me, there came tears. And I was on the other end of the phone, also in tears. He says, Mom, I would not wish it on anyone. He said, Mom, when you speak tonight, tell them all, please, please make sure they are vaccinated. And those were his words. Make sure. And to end it, I wish to thank all the people, scientists and all those who took part in producing a vaccine so that we can save the people of the world. This is a pandemic. We have little options. You either don't have the vaccine, you contract COVID-19, the outcome, you may come out of it okay, you may come out with this lasting illnesses, the long COVID, which you have then the rest of your life to go through with. You may never come out of it and you remain a vegetable for the rest of your life. This is my story to you.
Thank you very much, Angela. Perfect timing. Thank you very much for that. So we wrote 2 real-life stories of people's views and experiences in relation to the vaccines. So we're now going to turn over to the professionals. So first of all, we're going to sort of hear from Ethel Changa. And then I know Jim has joined us now, so I'm going to ask him to share some information with us about the situation in Hertfordshire, because Ethel works nationally and Jim works more within the county. And then, of course, we will ask Mosun and Dr. Aitai to make their contributions too. So thank you again, Angela. And I'm now going to say welcome, Ethel, my old friend. Can you talk to us, please?
Yes, thank you very much, Clive, for inviting me to talk. And good evening, everyone. I feel honored and grateful to be here with you tonight. My name is Ethel Changa. I work as a clinical advisor in the national team on the COVID-19 vaccination program. And I'm also quite grateful tonight because my colleague, Dr. Itai Matumbike, is also on the call, and you're going to hear from him as well. He's a medical director in Northamptonshire. and very knowledgeable around the efficacy and the science behind the vaccine. So Clive, I don't know if Itai is going to speak directly after me or at a later stage.
Yes, see, I was going to hear from you first, and then Jim, then Muslim, and then I thought with his perspective from that medical director's post, I'll have him conclude. And then we go, yeah, okay.
Okay, thank you very much. Yeah, and I also just want to start off by saying thank you very much, Sandra, for giving your reasons and your talk there about why you're not taking the vaccine, and totally respect everything that you've said, and also to Angela, who's also given her perspective. So it was nice to just hear those two narratives at the beginning. But like I said, I work within the vaccination program, and I work within what's called the clinical work stream. Within the program, there's a variety of work streams, all serving the purpose of ensuring that everybody gets, or those people who are eligible and those people who wish to take the vaccine are vaccinated in a safe way, and also in a way that is efficient. So we're looking at efficiency and safety and many other things. So as you know, with any mass program like the one that we are in at the moment, there's so many things to take into account. One of them is to ensure that there's equitable access to the vaccine for all people with protected characteristics. I'm going to touch on that later on as I just go through just outlining my role, and also some of the things that we've done to actually reach out to the less engaged communities. And yeah, so I'll start by just giving an outline of my national role. So like I said, we sit on the national platform, and really is to support the regions and to support the system in ensuring that the delivery of the vaccination program is equitable, but also safe and also efficient in doing it. At the moment, we're just under the 20 million mark in terms of the number of people who've been vaccinated. And believe me, there are people who are trying every day on the booking system to ensure that they get themselves booked and have a vaccine. And it's unfortunate that the majority of the people who are actually moving towards the vaccine and wanting to get vaccinated are not people who look, the majority are not the people who look like myself. So for me, it's about allowing and ensuring that people have make an informed decision with regard to the vaccine, and people have a choice. So if it's not now, then it doesn't mean it's never. So it's about giving people a choice and ensuring that people have the right information to make that decision. So what I'm going to talk about today is not really about coercing anybody. It's just saying, this is where we stand. This is what we're trying to do. This is what I think. And everything that I'm going to share with you is really from my own perspective and knowledge. So as I said, within the vaccination program, we've got the equalities work stream, and they are working with less engaged communities like ourselves who are not really engaged within the vaccine. So what we're trying to do, or what that work stream tries to do, is really triangulate what they're learning together with the clinical work stream to see what we need to do. So we're taking a bottom-up approach in the sense that we want to hear from you. We want to hear from the people who are on the ground about what it is that they need to know, what information is not reaching you, so that we make sure that information is available to you, and also what adjustments do we need to make for you to be able to get the vaccine. So there's a number of things that people say. For example, for ladies and women of color like myself, a few have said things like, you know what, Ethel, I don't really want to be pulling down my sleeve in front of other men and they see my arm or see my bra strap, just as an example. I just really need some privacy. So we're hearing these things, and these are the adjustments and the things we take into account in making sure that the vaccination centers and the different delivery models are taking all these things into account. So it's really about privacy, about dignity, about taking into account everybody's needs. So it's about what are your needs that will enable you to actually come and access that vaccine. So having webinars like this, Clive, is really, really crucial and really important for me, not just to give information, but also to receive information and hear from what the major concerns are. So I'm really glad that we've got a number of experts or colleagues who are on here who are also going to share from their perspectives as well. Now, I also want to let you know that, as I've said, we're just under the 20 million mark. So a lot of people have been vaccinated. And within the program, we've got different cohorts. We've got cohort 1 to cohort 9. And within those cohorts, people would have been invited depending on what cohort they fall under. Now we're moving on to, we've done cohort 1 to cohort 5, and now we're moving on to the other cohorts where it's vaccinating more of the masses, if you like. And the next coming weeks are going to be really quite crucial in ensuring that we are safe in doing that, and we are efficient in doing that, and we're following infection prevention measures in doing that, and ensuring that when people do come out to the vaccination centers, that they feel safe, and also that the IPC measures, so IPC stands for infection prevention control measures, are still in place. So it's all the things around social distancing, hand washing, hand sanitizing, wearing your mask, or and wearing your PPE, personal protective equipment, as you need to when attending the vaccination centers. So I'm not, in fact, I didn't really ask Clive how much time I've got, but I'm going to try and be really short now. So we've been really engaging with faith leaders, we've been engaging with communities, we've been engaging with stakeholders to really help us and give us the intelligence on what we need to do to make sure that we are reaching out to the communities, and also making sure that information is available. There is information, all the information I'm talking to you about now in terms of numbers. So if you want to know how many people have been vaccinated, what ethnicity, and any other information you want about the vaccine, is all on the NHS England website. It's accessible to anyone. You can access that and keep a track and a tag on that information. Now, I just want to, as I'm rounding up because of time, I just want to say that I am someone who had COVID-19 myself in March of last year. And when I had the virus, I was extremely unwell. I had it at a time when nobody knew what to do with the virus. Nobody knew what the virus was. It was an invisible monster that just came upon us. I was extremely unwell. Now, I live alone with 3 teenage children. I'm a lone parent, and I'm not ashamed to say that either. But so being at home with my teenage children, and feeling really, really unwell, and watching myself actually literally slipping away, was the scariest time of my life. I mean, I would never wish it upon anybody. And then at the same time, seeing my colleagues and other people of color losing their lives, I thought I was going to be one of that statistic as well. So actually being here, being able to talk to you, I feel extreme appreciation and gratitude for life. And the fact that I managed to recover from COVID, to me, is an actual miracle. And one of the things which I'll touch on at this time is, one of the things that really helped me at that time is how my faith actually played a big part in helping me. Sorry, is that a message for me?
No. I was just putting a message out there for people on the call to say, okay, if they wanted to send a message, there's a chance you are here.
Okay, that's fine. Yeah, anyone ask me any question, because I really cut it short with regards to the national picture. But so as a person who actually had COVID myself and almost lost my life, and the only hope I could find was through my faith and my Christian beliefs was in God, really, because that's who I could turn to. There was nobody else who could give me an answer for anything. So after having recovered, I've come to realize the true meaning and the value of life, and how I really need to embrace life, and how the small things in life that I wasn't really paying so much attention to are the most important things. So things like actually hugging my children, things like communicating with them, things like actually looking after myself in a different way, like exercising, fresh air, drinking my water, all sorts of things are actually all the crucial things that are really important, because we have this life once. So when the vaccine actually came along, to me, it was like a hallelujah moment. It was like, wow, I really am going to be, when it comes to my turn, I am going to be taking that vaccine. There's no two ways, no questions about it. And so for me, the vaccine is hope. It brings hope. It's something that is going to help us reach a sense of normality. I want to be able to visit my family. I want to be able to visit my friends. So the vaccine is going to bring that about for us. So some of the things that used to, and I'm just sharing a little bit more for you. So some of the, I think someone's mic is on. So actually, thank you very much. So someone's just given me the actual figures. We are just, are we over 20 million? Yesterday we weren't. As of today, it's 20 million. See, there we go. So I didn't have that most up-to-date figure. Edwin, thank you so much. So see, hurrah, so people are being vaccinated, and I tell you that a lot of people are not hanging about. They are making sure when it's their turn, they're going out there to get their vaccine. I also do want to say that with regards to the vaccine, as I've said, it brings about hope. For me, it's hope. It's that glimpse of hope, and it's that thing that will help us get to some normality. But at the same time, I totally understand that the experiences we have had as Black people of racism, of discrimination, of being the guinea pigs in other settings, of course we would be hesitant. Of course we would feel anxious about it. But so what we need to do now is to equip us with the right information. And as Clive said at the very beginning, I think Clive said there's social media telling us all sorts of things. There's information everywhere. The internet is just throwing all sorts of information that is increasing and embedding that anxiety even more. But what we need to do is we need to be really selective in the information that we allow ourselves to listen to, and actually help us and aid us to make the right decisions. So like I said to you, there's a wealth of information which is already on our NHS England website, as well as Public Health England. And also my colleagues who are here, who are going to speak next, have also got information that will help us arrive at an informed decision. Like I said to you, no one needs to be coerced. No one needs to be persuaded. It's about you taking the responsibility to arrive at an informed decision on what you want to do with regard to the vaccine. And I also just want to say, if you're saying not now, it doesn't mean that in a week's time you won't think differently or change your time. So do make sure that you have enough information to make your own decision. Not today, maybe tomorrow, maybe the next day, but you need to make the choice and you need to make the decision. So with that, I will stop there. And if anyone's got any questions, I'm happy to answer those. But I'll stop there, Clive. Thank you.
Okay, so thanks very much, Edsel. Can I just say, I'm conscious that there will probably be, I'm conscious that there will probably be a number of questions, but actually, I think what we could, unless there's a really urgent question, I know Heverin had her hand up, Heverin Shand, then if we can put the questions in the chat or hold on to them, when we've heard from the panelists, then we'll just go through all those questions and try and answer all of those questions in due course. Heverin, did you want to ask, is it an urgent question or can it wait until later? You're muted. Is that and okay, Heverin, we're going to take it that you're going to come back when
it was a mistake, Clive, sorry.
Okay, thank you. All right, okay, thank you, Etel. I think what you've presented is what is happening nationally, and the importance of us making our minds up, and not just listening to what we see on social media. I think we're going to ask Jim, who is with us, to tell us something about what's happening in Hertfordshire, and then we'll ask Mohsen to come in and share her perspective on this, as well as Dr. Itai as well. So Jim, welcome, and over to you once again. Jim, you still with us? No. He was on earlier on, sorry. Jim, if you're there, you're muted. Okay. Not sure what's happening with Jim. So I'm going to ask Mohsen, and Mohsen is she's our consultant psychiatrist who works for Hertfordshire Partnership University Foundation Trust. I know Mohsen has actually been involved in some of the work around this. Sorry.
Is it this the word?
Okay. So Mohsen, can you come in and talk to us about this issue, please?
Okay, thank you very much, Clive, for inviting me, and good evening, everybody. It's really lovely to be here with you all this evening. And you haven't told us how we can join the society, because I work in Watford. So by virtue of the place where I work, I think I should be part of this group, Clive.
You should be. And I'm going to send you the information tomorrow.
And as you can see, I'm a Black African woman. What more do you need? So hi, everyone. It's really interesting. I'm so happy that we're having this very mature conversation. The fact that within the same forum, we can share our opinions really means that, you know, we're open-minded and happy to communicate. I am not an expert in vaccines. I'm not a researcher. I'm a psychiatrist, but I will touch on the points that people have made over time and the information I have from reading and getting information from research results and experiments. As some of the speakers have already said, over 20,983,615 people have been vaccinated in the UK since the first dose was given about the 8th of December. They've had their first dose, and 895,412 people have had their second dose. So the vaccination program is really going good in the UK, and it's done in batches, as Ethel has described. There are people who have their reservations about taking the vaccine, and what I want to talk about is the different reasons that people have given in the various forums that I've spoken in. So people have given religious reasons, their faith as a reason for not wanting to have the vaccine, because some people have seen the vaccine as a sign of the end times, and some people feel that if you take the vaccine, then you are denouncing your religion, and it means that you don't have faith in God, that God can heal you. But as we know, many of our religious leaders have been coming forward to say, God actually cares about your health. Jesus Christ himself had a very active healing ministry. And even Muslims and other religious leaders have been coming forward to reassure people. Those of the Muslim faith, some people have been worried that the vaccine may contain pork, but the researchers have said it does not contain pork. Some people are worried about taking the vaccine when they're fasting, because they feel that they're putting foreign bodies into their body, foreign materials into their body, and when you're fasting, it should be a period of holiness. So again, people have provided reassurance regarding that. Some people have heard information that the vaccine actually changes your DNA, and it can change your makeup, the makeup of your body, and affect you in different ways. Again, the vaccines, the researchers have consistently said that it's an mRNA vaccine. It does not affect your DNA. It doesn't change you as a person. It doesn't change who you are. Some people feel that the vaccines may contain microchips, and you might think some of these things I'm saying are ridiculous, but you know, there are people that actually believe this. I've been in so many different forums, and some people actually believe that this is the case. So what might seem ridiculous to you might be something that's really worrying somebody else. So it's important that everybody's concern is taken seriously, and you don't feel, oh, people are just being silly, if you understand what I mean. So some people feel that these vaccines would contain microchips, which would mean that it can monitor your movement, monitor your life forever. Again, researchers have said vaccines do not contain metals, they do not contain microchips, and you're more likely to be monitored via your phone, your laptops, and your wristwatches and things like that than you are to be monitored from the vaccine. Some people have rightly been worried about being of childbearing age and the vaccine causing infertility. People who are pregnant have been worried, and also breastfeeding mothers have been worried about taking the vaccine. And Department of Health website, as Ethel has said, and also Royal College of Obstetricians and Gynecologists have put out information that the research hasn't actually been done in pregnant people. So those who are worried that the vaccines were approved too quickly, it is true that they were approved quickly, but research was actually done. The figures that we're showing, that we have, shows that they were volunteers at the beginning. So most of them were white population, 81.9% white people were part of the research group, 26.2% Hispanic, 9.8% African and Caribbean, 4.4% Asians. So they actually tested the vaccine across various ethnic groups, though more whites than the others. But they were all of adult age over 16 and above, and this test was never done on pregnant women. So they are saying that the test wasn't done on pregnant women, but if you have, pregnancy might make you vulnerable, or if you have other underlying illnesses, or you live in an overcrowded area, or you have family members who are positive or ill, that it may be best if you take the vaccine. The same advice goes for breastfeeding mothers, and it has not been shown to cause infertility. Some people obviously are worried about past history of experimenting on the Black population. Tuskegee experiment as we mentioned earlier. But the truth of the matter is that the vaccine comes in a vial, and in that vial, you might give like 5 to 6 doses, and they don't determine, they're not separated into what vials goes into Black people, Asian people, or white people. So from that same vial, you'd give it to the white person, the next Black person, the next Asian that's on the queue for the vaccine. So you're all getting the same thing. There isn't a separate vaccine that is put aside for Black people or certain ethnic groups. So we're getting the same thing. And what people have been calling for, I don't know if Ethel would know this from the national statistics, is that why don't we have more Black vaccinators? So this is some of the observations that people made, that most of the nurses and healthcare professionals giving the vaccines were white, that if people saw that there were Black nurses, Black healthcare professionals, you know, males, females giving the vaccine, it might give them more confidence seeing person of the same color as them. So many people, many areas were trying to get ethnic groups involved in the vaccinations themselves. And then some people have been worried about if you've had COVID, then you don't need to have the vaccine because you'd have developed antibodies from having COVID. But again, research has shown that you're only immune for a few months, and after that, your immunity goes. That's why you've heard some people thinking, oh God, am I having COVID twice? Because after 5 months or 6, where you have that immunity after you've got the infection, you might get reinfected again. So having the vaccination still offers longer term protection. That's why you have to have vaccine 1 and then vaccine 2. So when you have the first vaccine, it triggers your body, the body sees the foreign body, and it triggers them to provide an immune, to have an immune reaction to fight the foreign body. So by the time you get the second dose, you're building more immunity. And that's why you might see figures such as first dose will offer 60 to 70% protection. And then by the time you get the second dose, because you have more immune response, your protection will then go on to 80 to 90%. So it's really important that you take the vaccine, even if you've had COVID infection. And then obviously some people with underlying medical conditions like sickle cell disease, like severe reactions, allergic reactions, are worried about having the vaccine. So research has shown that the Pfizer biotech might predispose you to more severe reactions than you'd have with the Oxford AstraZeneca. And the other advice they're giving people, GPs will tell you that come and have your vaccine within the GP surgeries or even in hospital. So remember, there are lots of community centers that have been converted, faith, churches, mosques have been, temples have been converted into vaccination sites in the community centers. If you have a history of allergic reaction, do not go there for your vaccination. Go and have it in hospital. There are hospital A&E departments that are offering the vaccine. This is because you're more likely to have resuscitation material. And in your questionnaire that you'd be given before you take the vaccine, you must declare that you've had the allergic reaction so people know and they're prepared for resuscitation. The other thing they do is that you're observed for a while at the vaccination site before you're allowed to leave, before you're allowed to drive and things like that. So I just thought I would say a bit about reassuring people. It's a personal opinion, it's a personal choice. The UK government at this point in time is not forcing anybody, nothing to do with their profession, ethnicity. In some other countries, they're talking about COVID passports and travel vaccination certificates and things like that. But as far as we know in the UK, you are not being forced to have the vaccine at this point in time. It's a personal choice. Some people are worried about, obviously, if you're ethnic minority, it means that you have family abroad. Some people have said they won't take the vaccination because they're standing in solidarity with underdeveloped countries and their family who are abroad and do not have the vaccine. Again, many of the developed countries and richer countries now have a COVAX system where they're supplying vaccinations to less buoyant countries. So I've seen deliveries in Kenya, Ghana, Nigeria. So they are trying to support countries who are not able to afford, who are not as rich to get the vaccine. So if you're one of the people standing in solidarity with your relatives or with other African countries, it will get to them at some point. So I'll stop there. And I just hope that I've been able to clarify. I've had COVID myself. I wouldn't wish it on my enemy. For the first time, I had end-of-life conversations with my children because I thought, oh my God, if I die, I need them to know about this, that. And they thought, Mom, you're going mad. Don't tell us that. Oh, well, you know how teenagers behave. Why are you telling us that? I'm like, I don't know if I'm going to come out of this. So it's really terrible. I couldn't breathe. I called out 999 because I thought this is it. They wouldn't take me to hospital. And I'm like, don't leave me here. I might not make it if you leave me. I need to go. I need to be monitored every second. I was that hysterical. And about long COVID, I'll just finish with long COVID. I can see Clive is going to shut me up in a minute. Long COVID, these can be some of the complications you get from having COVID. So it can affect you, you can last for months and years. Research is still ongoing about people that still have the sequel, the side effects from their infection months after, breathlessness, palpitations, chest pain, being tired all the time, anxiety, depression, mental health complications. So overall, from what we've seen, the advantages of taking the vaccine far outweighs the advantages of not taking them. Less hospital admissions in the UK, less deaths, less seriousness with the disease, with vaccines taken so far. So my personal opinion is that you should take the vaccine. Obviously, it's my personal opinion. Thank you for listening.
Thank you very much, Mohsen. I think you've managed to cover quite a lot of questions that people are asking and will probably continue to ask. It's all part of us coming together, as you've said, to try and exchange views amongst ourselves. You'll see that the people who are speaking for and against is from our community and is speaking from their knowledge and their experience, and that's much appreciated. So thanks again, Mohsen. I'm not sure what's happening to Professor McManus, but actually it means that we can focus on the expertise that we have in our community. And I'm going to conclude this part by asking Dr. Itai Matumbiki, our clinical consultant clinical
Medical
director,
director.
medical director for Northamptonshire Healthcare NHS Foundation Trust, to share his views with us. So welcome, Dr. Yatai.
Thank you very much, Clive. Thank you very much for inviting me, and it's really quite powerful that you've run this event. It's a very good community engagement event, and I'm probably going to speak to colleagues about running such similar events more locally in Northamptonshire as well. The first thing I want to say is, I think listening to Sandra speak this evening, just sort of filled my heart with pride, in the sense that people are finding it brave to be able to come out and speak about how they feel. There's been quite a lot of intimidation on social media and other spaces where people have felt blamed or victimized for taking a view about the vaccine, and the fact that people can come out and speak openly about how they feel and the reasons that they have for not taking the vaccine or for taking it, is a very positive thing, because it actually stimulates that dialogue. And I will touch on some of the points that Sandra made today, because that makes it easier for me to deliver some of the points that I want to make this evening, and allow you to make an informed decision about vaccination. I'll start though by giving a little bit of a personal reflection, about why I'm so passionate about spreading the message, about COVID vaccination. So like some of the stories that you've heard of people having had COVID, I didn't have COVID myself, but I was in a very tricky situation. I'd just been appointed executive medical director at Nottinghamshire. Sorry, I think there's someone talking.
Let me see. Sorry, can I ask people to mute, please, unless you're speaking?
Okay. So I'd just been appointed medical director at Nottinghamshire, when the first wave of COVID hit. And what happened was that there was actually an outbreak on one of my wards. And one of the consultants who I work very closely with, who reports to me, contracted COVID from the ward that he was working on. He then became very ill and was in ICU for almost 3 weeks. I wasn't sure whether I was going to see my dear colleague again. I felt somewhat responsible in my role as a in almost as an employer role, that someone who, I employed to work within the hospital had, contracted an infection which was, possibly going to end their lives, and, I felt responsible for that. Thankfully, that there was a happy ending to that. My friend and colleague did recover from COVID, did actually come back to work, but albeit on a part-time basis, because they did suffer the effects of long-term COVID. I think this for me, it left me really quite keen to see if we could have a solution, and if there was anything that I could do to contribute to that effort, I would be very keen to get involved in that. When the vaccine started being developed, and there's a point that Sandra made about how rushed this was. It's important to note that the reason why it's called SARS-CoV-2 is because actually there was a SARS virus before, and it was a few years ago when that sort of pandemic hit, that there was quite a lot of research into developing a vaccine for COVID. So we're by the time people like Dr. Kizzy Corbett, who developed the mRNA technology for the Moderna vaccine. By the time the second pandemic hit, by the way, Dr. Kizzy Corbett is of African American descent. By the time she, this very bright young scientist, started developing this mRNA vaccine, we were onto the second wave, and the technology was already there. And it was really about starting to develop the clinical trials that would allow us to, provide this vaccine to the world. Sandra made a point about, the first people being the ones who were experimented on. And it is true that there were clinical trials. The clinical trials tend to happen in different phases. They're phase 1, 2, and 3. The clinical trials that were involved in the development of the vaccines that are currently approved for use in the United Kingdom will have involved over 120,000 people. So there were, or 90,000 people, sorry. There were 43,000 people involved in the BioNTech or the Pfizer vaccine. There were 30,000 people involved in the Moderna vaccine, and there were 23,000 people involved in the Oxford vaccine. So by the time that those vaccines started being, put forward for use on the population in December 2020, these clinical trials had already been completed. And there was robust clinical evidence showing how effective these vaccines were before they could be approved by the MHRA for use in the population. So just to give a bit of a background of what the MHRA are, they are the Medicines and Healthcare Products Regulatory Authority. So every single medicinal product which is approved for clinical use in the United Kingdom needs to have approval from the MHRA. They're an independent regulatory body. They examine the clinical evidence that supports whatever medicinal product is. They look at not just the effectiveness of that product, but they also look at the safety data, and they provide that independent expertise around that. There are 160 candidate vaccines that started having those clinical trials. There are quite a few vaccines which are out there. Different countries have got theirs. And actually, there are only 3 which are approved in the United Kingdom. And that approval is based on the fact that there is published data on their effectiveness and their safety. And speaking of, guinea pigs, I think like Mohsen said much earlier on, it's actually the white people who've been more of the guinea pigs in this situation, because most of the people who took part in those clinical trials were actually white, with a minority being of Asian and Black ethnic origin. So after we started the rollout, of the vaccination with about 20 million people having received their first dose, we've actually started to see, what's called phase 4 of, the research. And phase 4 is really the observational studies that take place when a vaccine or a medicinal product has been released for or approved for use in the population. And one such compelling study was the one that was published by the Lancet last Monday, looking at the Scotland population, which is it involved 5.4 million people, and what they saw, the parameter that they used was about, whether the vaccines actually prevented hospitalization from COVID. And what they did was to test people using the gold standard for testing for COVID, which is the PCR test. They took groups and they matched them for age and gender and ethnicity. Looked at the people who had actually received the vaccine and looked at the people who hadn't actually received the vaccine. And the emerging data from that is that, if you've been given the Oxford vaccine, there was a 94% reduction in hospitalization. If you had the Pfizer vaccine, there was a 90 or 89% reduction in hospitalization. This is clear evidence, that these vaccines actually do work in preventing hospitalization from COVID. And it's even more compelling than the clinical trial data that led to the rollout of the vaccination program. So in terms of us needing that reassurance about do these vaccines actually work? Are they actually safe? We now have that data. A lot of points have been made about pregnancy and impact on fertilization, on fertility, and actually within the clinical trials themselves, for instance, the BioNTech or the Pfizer trial, 23 women actually did become pregnant after they received the first dose of the vaccine. Which is clear evidence that the vaccines themselves do not actually cause, or prevent you from being able to conceive after you've had it. And like has already been mentioned, the Royal College of Obstetrics and Gynecologists have released statements really supporting, this side of things. So the evidence is there. People ask, why was it rushed? Usually it takes about, 10 years or so to develop, a medicinal product, and for us to have seen, the long-term effects of that product before it's, it's approved by the MHRA. Now we have to sort of look at the circumstances that we find ourselves in. There are now, 2.563 people dead, 2.563 million people dead worldwide from COVID. The number of people who've died from the COVID infection itself, actually exceeds the number of people who've actually, the number of people who've died is far less than the number of people who've been vaccinated. And the number of the risk of death from COVID, is a lot higher amongst the Black and ethnic minority people that we've got. So you've got there's a 4 times risk of death if you are from, a Black and Asian ethnic minority background. There's a threefold risk of death if you're Asian. So 4-fold risk if you're Black, 3-fold risk of death if you're Asian. It is particularly important for people, of a skin color that I have to have this vaccine. So I was one of the first people, when it was released, to have my vaccine. I got the Pfizer vaccine, and I've now had both doses of the vaccine. I did suffer some, mild side effects from having the vaccine. After my first dose of the Pfizer vaccine, I did feel heaviness of my arm for a couple of days. After my second dose of that vaccine, I did have a 24 to 48 hour period where I did feel a little bit feverish. And that was quite reassuring for me, knowing what I know about, what happens when the body launches an immune response. All those proteins that you release in developing an immune response are what make you feel under the weather. And after those, couple of days where I did feel feverish, I'm perfectly all right now, back to normal health. And I feel, all the better for it. The decision to take the vaccine, and notwithstanding the concerns that people have had about pharmaceutical companies, notwithstanding the concerns that people have had about racism, the decision that I took the vaccine was really first and foremost quite selfish. It was about protecting myself from what I know to be a lethal virus. It's taken so many lives, it's changed all our lives in one form or the other. The decision was based on trying to protect my own family, my children, the people around me. It was also about protecting the community around me. So there's the question about, should we wait and see what happens, before? Yes, of course, like Ethel said, this is not about coercion. This is not about sort of forcing people to do something that they are uncomfortable about doing. But I just want to leave you with a couple of thoughts there. So far in the UK, we've had, 20 million people who've received their first dose, which constitutes about 33% of the population. Now, how you eradicate a communicable disease is by developing what's called herd immunity. The herd immunity and the prevention of that, spread of that condition is based on the percentage of the population who now have that immunity to that condition. So your chances of being able to, to stop the spread and being able to, to progress to, normal life is based on the percentage of the population who are actually immune to that communicable disease or that virus. And it varies from disease to disease. For COVID, the percentage of the population that needs to be immune for us to eradicate the condition is 90%. So in terms of our population, we have got a long way to go. So when that jab becomes available to you, think about not just yourself, but think about, the impact that you could have on the rest of the population by being vaccinated. And I think that's one of the thoughts that I'd leave you with. I think, people are entitled to, their decisions about, the vaccine, but let that decision be based on, the evidence that's from trusted sources. Let that decision be based on, what you feel is right for you and protecting your own families. Thank you very much.
Oh, sorry. Thank you very much, Dr. Etai. That's been very enlightening amongst everything else. But I think what we now want to do is to try and open this up because there have been a number of questions. A couple of my colleagues have been keeping on. I've been having a look at the chat, and Marcia and Amadou, I don't know whether or not we could kind of just take the questions from early on and see if we can run through them, because somebody's asked me the question. We're going to go through the questions. I think that as far as possible, I'd like us to see if we can do so within the next 20 minutes, but and I hope my colleagues can stay. Did any of you?
Okay, I'll give you some of the ones that I've noted. There are a few, but one of the
should we go down the list, Marcia?
This was the list. This is part of the list.
Okay.
And someone said they've got serious allergies, and they were advised by their doctors from they were little not to have any vaccination. So they're thinking about what to do for now.
I can take that one.
Yes, please.
Okay, so my first port of call is to say that, if you've got any concerns about long-term conditions or allergies, the go-to person is your GP, your current GP. They will know your medication history. They will know what other medications you're on, and they will be able to, using what we call, the immunization green book, be able to sort of advise you accordingly about, whether or which vaccine to take. So as Mohsen has already indicated, usually the BioNTech or the Pfizer vaccine is the one to avoid if you've had serious allergies. Now, when we talk about serious allergies, we're talking about something called an anaphylactic reaction, and an anaphylactic reaction is a very serious reaction to either a medicine or or a food or any chemical, whereby you get intense swelling on your face and your airways, and you need to have resuscitation within a hospital setting. So usually, if you've had any of that serious type of allergy, it's important to avoid the Pfizer vaccine, and your GP will tell you to avoid the Pfizer vaccine. there are alternatives, and that is the BioNTech, I mean the Oxford vaccine. And what's interesting is that most primary care networks, because of the convenience of being able to store the Oxford vaccine, will stock that one. Usually the Pfizer one is usually available in the hospital setting anyways, because it's difficult to store at sub-zero temperatures. And if you're receiving your a vaccine in those spaces, you'll be asked to stay from between 15 and 30 minutes. That goes for everyone, because if you are going to have an allergic reaction, it will happen during that time, and there will be clinicians available to resuscitate you if something like that were to happen.
Thanks very much. Next question, Marcia.
Is the vaccine safe for someone with heart problems?
Yeah, like I said, the Green Book is the go-to, advice for that. There is no, it depends on what the heart problem is. Actually, the advice is if you've got long-term conditions and are therefore at risk, or what we call, clinically extremely vulnerable, you're actually on a priority list to receive the vaccine, and actually to receive both doses of your vaccine within 3 weeks. So there's a protocol which is available, and your GP will have access to that and will be able to look at it.
Okay. Someone has said how much research has gone into other ways of protecting from COVID-19, for example, taking vitamin D, if you're not happy with taking the vaccine.
Okay, so the evidence around vitamin D has been something which has been controversial. So what we know is that through looking at a number of studies which have looked at vitamin D and its use in either preventing acute respiratory infections or chest infections, is that some studies have shown benefit and some studies have not shown benefit. When you look at how you determine whether something is useful, is by looking at all those studies and doing what's called a systematic review or a meta-analysis. And that's just, looking at the statistical evidence to actually then be able to answer that question. What's been shown is that vitamin D supplementation does demonstrate a small benefit, but it is still safe. So what we do at our trust, which is NHFT, is that we offer our clinically extremely vulnerable staff, vitamin D supplementation. In addition to that, can I just point out though that vitamin D does not offer specific protection against COVID-19. It does, reduce the risk or the clinical risk of severe complications from respiratory conditions as suggested by the evidence. But that evidence, I must point out, is quite weak. So the only way that you can actually say that a medicinal product or or a supplement is definitely going to offer you protection is by doing something which is called a randomized controlled trial. And a randomized controlled trial is where you sort of sit down, you offer one group of people the product, and then you offer another group of people, you offer them a fake drug or a fake product basically, and then you measure how many of the people in the experimental group and how many of the people in the control group go on to receive that infection or go on to be protected from that infection. And there have been no randomized controlled trials looking at vitamin D and COVID. I must point out that there are some ethical concerns about actually carrying out such a trial when we know that the one thing that's going to allow you to prevent the infection is by building up the immune system, and the vaccines do that. There are a number of trials going on looking at people who have actually, been infected with COVID, and whether certain medications can be effective. Recently, the MHRA, approved the use of, things like dexamethasone, which is a steroid in treatment of people who are actually in intensive care and, are suffering from acute effects of COVID. It's important for us to always be careful, about what we read on the internet and what we, the advice that we are receiving from various sources. There are lots of people who are trying to push their medicinal products who unfortunately, might stimulate, lack of confidence in certain things which are out there at the moment. And there are a number of conspiracies, counter conspiracies about, some people who are trying to push their supplements, sponsoring, adverts or, infographics that criticize, the things which have been tried and tested. I think let's just be careful about the sources of information that we've got. Let's just try and seek the trusted sources of information. Our go-to, as Ethel said earlier, is the NHS England coronavirus website. You'll see a lot of information about, the clinical evidence that's there. You'll see information about vaccination, etc. Another place is the www.gov.uk website. You'll see a lot of information, and even some of that information I shared earlier about the Green Book and the advice about long-term conditions can be found in places like that. So my message to everyone on this call is please be careful about the sources of information. Some people can sound very, very convincing. Some things that are circulated on social media can sound very, very convincing, but please use the trusted sources before making your decision about things.
Great, Clive, I've got a few questions that I wanted to pick up on as well, on top of Marcia's.
Are you carrying on along the same vein, Amadou?
No, there's a theme here that we haven't picked up on, which I just want to cite to doctors' attention. Maybe you can deal with it. And these are to do with the side effects. So somebody said from their family, somebody had a vaccine 3 weeks ago and had been very ill since. And that person previously had no underlying issues. And extended family members as well, similar experience. And what they were saying is the media doesn't seem to pick on these things. And their question is, why do you think there's no balanced view on this? And you cite yourself with your experience, which I think is good to address.
Okay. So the first thing I'll say is that for every single incident involving a medicinal product, there's something called a yellow card that we have to fill out. So for all of those people who will have suffered those allergies, the GP will complete a card about that adverse reaction. And we then get all that data collated to us. So for instance, when we had 2 incidents of severe anaphylactic reactions following the BioNTech, this was reported. And that led to the MHRA changing their guidance on who should receive this and when. It's also important for us to be careful. So in order for you to determine that it is actually the medicinal product that has caused that infection, you have to rule out a number of different confounders. So if you receive a vaccine, say today, we don't know whether at the point of you receiving the vaccine, you had not already been infected by, a respiratory infection. So you may not, be testing positive for COVID or anything like that. We do know that there's still, a rhinovirus, which is one of the respiratory infections, which is still circulating out there. And that can actually, mimic, COVID-19. So in all of these cases, what tends to happen is that these people are tested. There's a careful follow-up of them, and all of this data will become, published over a long period of time. Some of the cases that you're describing, we need to look, against the number of people that have been vaccinated. So you've got about 20 million people across the United Kingdom who've now been vaccinated. If these adverse reactions were as common, we would have heard that, you know, there are millions of people who have suffered severe reactions from the vaccines. Do you understand my point? Okay, so the cases reported, you know, some of these, I'm not trying to say that they don't happen. They do happen, and we do actually, you know, in our kind of regional medical directors call, do get reports of, you know, the number of adverse reactions that have happened from different medicinal products. And what happens is that the MHRA have got a responsibility to review the approval of a medicinal product based on, you know, the post-approval, you know, population rollout of that product. So if the proportion, you know, of adverse reactions or allergic reactions was exceedingly high, you know, I can guarantee you that Pfizer and, you know, Oxford vaccine would have been, you know, stopped from circulation already. The safety data, you know, which, you know, we're getting from, you know, the 5.4 million observational study in Scotland is showing us that actually the vaccines are, one, very effective at preventing hospitalization, and number two, they're actually, you know, very safe generally.
Thank you.
Sorry, can I just quickly speak, because it was me that posed that question. It's C. Morrison on the screen. So Dr. Attai, I was just wondering, because my father-in-law, if I just take that one person, is a very active person, is always out, he loves walking, he drives. In the 3 weeks, he's not been able to do any of that. And he's had to go to the GP twice. And they've sent him for the tests that you mentioned. So he's undergone blood tests, and he's had no underlying symptoms. So we've watched a man who was very healthy is now like a cripple. So for us, it's very concerning. And when he went for the vaccine, A, he was never given a choice of which one he could take. 2, he wasn't given informed consent. So he was never told what the vaccine's side effects would be at no point during the vaccination. And I think that him having side effects, because it definitely, for me, you go from healthy to 2 days straight after becoming something different, and he is 82, so you could say, oh, he's older, but with no underlying symptoms, something has gone wrong somewhere. But he was just not informed of the side effects. So that's my point. Where is the knowledge that people need to have for anything that is a short trial of a year or so, however long it's trialed? It's a very short trial. So for something like that, informed consent for the community is very important. And that's the point I wanted to, and I don't really feel like that was addressed in your answer.
Absolutely. So, the first thing I'll say is that there is a protocol for vaccination, and obviously it's very difficult for me to comment on an individual case, and which I have not been involved with personally. But I can just share, what the protocol is for vaccination. So informed consent is very much at the center of all this. What usually happens, I'll give you the experience of what happened when I went to have my vaccine. So when I went to have my vaccine, first of all, I sat down, with a prescriber who went through a crib sheet. It's a list of questions that she had to ask me about, my conditions, about, my allergy history, about all of that. And then she then said to me, from what you have told me today in terms of your history, I think, it's safe for you to go to the next stage. So I then was asked whether I wanted to take the vaccine and whether I was happy to take the vaccine. And I actually signed a consent form to say that I was happy to do that. And that's when I proceeded to go to a different room. What was interesting was that the person who was actually going to give me the jab then asked me another set of questions similar to the ones, that I had been asked by, the prescriber who was in the vaccination center. It took, all of about 30 minutes, for me to actually have my jab before I had my jab, and then I left. Another interesting fact was that when I went for my second dose, regardless of the fact that I had answered all these questions before, I went through the same process. And, I was asked those same questions. I was asked about allergies. I was asked about any reactions. And I gave my consent to have the vaccine before I actually went into the next room and had that. So there will be various reasons where, consent may not be sought. So if you do not have capacity to give consent, and I'm not sure what the circumstances for your dad were, if you do not have capacity to give consent, what might happen is that your doctor or your responsible clinician may elect to give you a medicinal product within your best interest. So if your dad was someone who was who had was at risk because of their long-term conditions, because of their ethnicity, etc., and it was felt that on balance, it was in their best interest for them to receive the vaccine, then that would have happened. So I don't know about the individual circumstances surrounding your dad, but I am sorry to hear that, after taking, the vaccine, that your dad has, not been well. I wish him all the best. And I must say, that, there have been, some, isolated incidents of where people have really sort of suffered some, significant side effects. But it's important for me to point out that these people constitute a very small minority of the people who have been vaccinated. The majority of people who have been vaccinated will not have had these side effects. The MHRA monitors that data very, very closely because the approval of a product can actually be withdrawn. So we've seen lots of products where, there have been too many significant incidents and deaths, even post-approval, post-clinical trial approval, and they've been withdrawn for that reason. Now, with 20 million people vaccinated so far, if that was the case with any of the vaccines that we've got approved at the moment, they would actually have been stopped.
Okay,
thanks very much. Can I just check? Marlene has got her hand up. I know we've got these other questions, but
yeah, can I say something, please, Clive? Doctor, one of the questions I wanted to ask you, do you know the reason why you were given the Pfizer vaccine instead of the Oxford one?
Oh, at the time that I got the vaccine, the Pfizer one was the only one that had actually been approved. And for me, I didn't care which one, to be quite honest. So I was happy to have either the Oxford or the Pfizer. I was just desperate to have a vaccine at that time. So I was one of the first people to have the vaccine when it was made available to clinicians. So that's why I had the vaccine. So the question that you ask about, the choice between the Pfizer and the Oxford, when the vaccination program actually started, and Ethel might be able to shed more light about, the kind of supply chain at the moment. When the vaccination program started, my experience from my area, which is Northamptonshire, was that we had actually more people wanting the vaccine than we had supply of the vaccine. So, whatever we got from center, we pushed and we gave to the people that were waiting in line to receive it. So you'll find most of the people who got the vaccine in the early stages around December time will have had just the Pfizer vaccine, because at that point, that was the only vaccine that was approved, for use in the United Kingdom. The approval process was based on the analysis of the data and the efficacy data, which is the effectiveness of the product and the safety of the product.
And which one has got the more effective? Is it the Pfizer or the Oxford one?
There's very little to pick them apart. So if we look at the trial data, the Pfizer vaccine had an efficacy of 95%, and the Oxford vaccine had an efficacy of 90%. But when you look at some of the observational data, and that's based on how effective the vaccines are at preventing hospitalization, it's actually the Oxford vaccine that appears to have a 94% efficacy at reducing hospitalization from the Scotland study, and the Pfizer, which has got an 89% effectiveness at reducing hospitalization. That's from an observational study. Now, if I can just qualify that a little bit, if you're ever in a position of wanting to determine which drug is better, you need to do what's called a head-to-head clinical trial. Where you do a clinical trial where you're giving one group of people, you're randomizing and you're selecting one group of people to have product 1 and another group of people to have product 2, and you're analyzing those people based on their age and their ethnicity, etc., in what's called a double-blind randomized controlled trial. We haven't done a study like that for any of the vaccines. So we have to take those data, with a pinch of salt in terms of deciding which one's better and which one's not.
Sorry, Marlene. Sorry, Marlene. Marlene. Sorry. We do have a number of other questions that people want to ask.
No, just a quick thing. You said it's white people have been tested more. Remember that they do a lot of their trial first in Africa before they come to Europe. And a lot of these testing started a long time ago, because they haven't just started doing this vaccine now. They've been trying it for a number of years before they've actually started to perfect it now, even if it was for other things. So we have been more of a guinea pig than the European. I wanted to get that point in.
Okay, Marlene, thanks very much. I think Dr. Atai has frozen there.
Yes, I can see that. Oh dear.
But just to say, I think I made a point very much at the beginning that there's a history of us being guinea pigs, which is part of the reason for some hesitancy among some of our communities. So that's
but he did say that they have been more guinea pigs than us on
no, he was speaking about this specific situation, but actually the thing that you're talking about is an historical thing that he is not.
They have started this sort of testing in Africa before they bought this vaccine in Europe, because they've been doing this test for a number of years on vaccine per se.
Okay, thanks very much, Marlene, for that. Marcia and Amadou, I mean, we do have some of our other speakers on the line. I think Dr. Atai lost us.
I think a lot of the questions have been answered as he's been going along.
Okay.
The only other one that I can see will be, will we be asked to take the vaccine annually?
Okay. Colleagues, Ethel, Mosun, have you got a view on this? I think the indications that I've heard of is that it may become like the flu vaccine, that we might have to take it every 6 months. I don't know.
Yeah. So because the research is still ongoing, there isn't a final word on that one, Marcia. It's something that will probably come along as more is known about the coronavirus and the vaccinations. But yeah, there's no guideline suggestive of annual vaccinations just yet.
can I just, I know, Marcia, you said you've sort of summarized the question, but somebody didn't ask me the question. Are we going to answer all of the questions if we could? So if there's anyone who thinks that their question hasn't yet been answered, could you just put your hand up and we will sort of try and pick that up. I think I see Hartley, you're putting your hand up. You got a question? You're muted at the moment. You'll need to unmute if you want to speak. Did I know? Oh, I see.
You're muted, Hartley. Unmute yourself.
Yeah, no.
Hey, can you hear me now?
We can, yes.
Clark, is the doctor still there?
I think he may well be coming back, but I think we've lost him for the moment. What was your question?
I've got a question, Clark, but I want to put it to the doctor.
Okay. We will see if the doctor. We go to Mimi and Pearl. You had a question. You had your hand up to ask a question. You'll need to unmute if you want to speak, or at least if you want us to hear you.
Looks like the doctor is back.
Oh, he's back.
Okay, so let's deal with Mimi first, then we'll come back to Hartley. Mimi, take a minute to speak.
Hello, thank you. Can you hear me clearly?
Yes.
Thank you very much. Yeah, I'm known to be a bit controversial. I hope I don't, offend anybody. But I just wanted to. I'm a bit confused about the pushing on this vaccine to the Black community. The doctor mentioned about herd immunity earlier, and did he say about 90% of the population has been vaccinated? Then there's a good chance that the majority of the overall population will be protected. Was that correct, or was I just hearing?
Yes, I think that's the concept along those lines. Yes.
Thank you very much. So if we look at the numbers in this country for the actual African descendants that reside in the UK, I believe we're a very small population. Are we not sort of 10% or something to that effect?
Less than that in the population as a whole, but that varies from place to place.
Okay, so if we look at the majority of the crowd in this UK, is it not them who should be put under pressure to take this vaccination? Because with the history that African descendants have had over the centuries with the European and their medicines, and you just have to open a newspaper or or an old or even a recent book to see what the history is with vaccinations and Black people. So at this point, I feel that it's almost on the border of her being harassed, because every time you turn around, there's somebody trying to pressure you into taking this vaccine, which none of us know exactly what the true ramifications of taking a vaccine is. And the people who are actually prone to contracting this COVID-19 are those people who are on the front line. They're hands-on, right in the face of the devil with the virus. And it's not people who are just going about their daily business and keeping a quiet life, maintaining a good diet and a good health and so on. But this push to take this vaccine, I really feel that it should be an individual's choice. We've already had all the information that's out there. You don't have to go looking for it. It's in your face 24/7. And I just feel now that it's on borderline harassment. Now, what I want to say is, for those people who are representing the government, the health service, what I want to know is, when is the government going to start paying reparations and stop pushing vaccinations? Because vaccinations is not what's going to help African descendants at this point. If we were really prone to this COVID-19 things, we would see what's happening in Africa, where the majority of Africans reside. They would be really literally, people will be dying in the street, like how Melinda Gates said that she had this big vision, and God forbid that would ever happen. It won't. I'm quite confident. So I'm just, you know, every time somebody speaks to me about the vaccine, it's like they put me off even more because they're pushing me into something I feel that's not really in my interest. Why don't they push good health care, normal health care, push for good education for our children, push for housing, you know, because they even tell you the reason that people are suffering with poor health in this country is because they don't have the right health care. They don't have access to the right diet because of poor income. They don't have good housing. And there's a host of other underlying issues, you know, that things that we need attention for, excluding this vaccine. There's people coming out the woodworks who don't speak about issues that need to be spoken about. There's all this crime and violence that's going on amongst the youth.
So Mimi, I think that we get the point. Certainly,
that's my point.
Yeah, certainly what I would say is that I don't, any of us here would disagree with your points, but it's not an either or situation because we are where we are. And actually, I don't think many of us would disagree with you in saying that actually that kind of investment, that kind of consideration into our general well-being across the board, educationally, in terms of employment, in terms of general health care, in terms of our general well-being, is a fundamental deficit that we've had up to now. But there's no doubt about the fact that certainly from the first phase of this issue, it has adversely affected us more so than it has the white community as a comparison. And I think that's a reality. Yes, Ethel, you want to come in on this?
Yes, let me just come in there just for 2 seconds. Mimi, thank you so much for your perspective. I think it's really good that you're open, transparent, and honest about your position and how you feel. But what I want to say to you is from the very start, no, you should never ever be in a position where you feel pushed or coerced, and the conversations that we're having are not really about coercing or pushing anyone. It's really about ensuring that people know where to get the right information to make an informed decision. Where we are standing from, it's about, have you got the right factual information for you to arrive at your own decision? No one should ever, no one should ever feel coerced, and that's a point I wanted to make. So having these conversations is really about, do you have the right information? And obviously, based on the history and the things that we've had to endure over the years, the discrimination, the racism, of course, we would hesitate. Of course, why wouldn't we? But now we're saying, look, do we have the right information? And it's an individual choice about whether you take the vaccine or not. And that's the standpoint.
Absolutely.
Thank you, Ethel. Thank you, Ethel.
Sorry. Angela, you wanted to come in. You had your hand up for a question. You're muted. You're muted.
Yeah, I just wanted to say that my son, who was not frontline, big strapping young man, healthy young man, and he contracted COVID-19.
Yeah, thank you very much for that.
Can I just?
Yes.
Sorry,
yeah.
Can I just sort of underline Ethel's point that if it's at any point in this discussion, it's come across as though we're trying to pressurize people to have the vaccine. That's not the intention. The reason why I'm here today is to just share information, share data, and allow people to make an informed choice. I don't represent the government. I'm here as a clinician. I do work in the NHS as a medical director. One of my responsibilities as a medical director is to ensure that the local population that I serve, receives the healthcare, that it deserves. One of the things that COVID has highlighted has been the inequalities. And so a lot of the reasons why there is that fourfold risk of people of a Black and ethnic minority background, one of the factors associated with that is the economic circumstances that we find ourselves in, as a BAME community. Some of the environments that we work in, which put us at significant risk. So for me, you know, my absolute priority as a clinician, as a medical director, is about ensuring that, you know, the health of the population that I serve, you know, is not based on race, and that, you know, we reduce the inequalities that do exist, you know, in the health service, and ensuring people have got, you know, good access to potentially life-saving treatment, you know, is what's motivating me to be here today.
Thank you. Artley, in fact, wanted to ask you a question, Dr. Attai. So Artley, do you want to come in there?
Yes. Hello, doctor.
Hi.
Hi. The thing that worries me, I'm 78 2 days ago, and I get lots of letters and phone call to take the vaccine. I still hadn't made my mind up yet. And the reason why, I've got many reasons, but the main reason is that the government keep banging on, and you said it tonight as well, that as Black, we're 4 times more likely to die from it than a white person the same age as me. Now, if that's true, what is the reason?
So the reason is a number of factors. So one of the things that we've noticed about COVID is that, you know, long-term conditions make people clinically extremely vulnerable. So things like diabetes, and, you know, more so as the data has become available about the people who are actually dying from COVID, things like diabetes and heart conditions and obesity, unfortunately, you know, are overrepresented in our community as Black and Asian and minority ethnic groups. And for those reasons, you know, it's not, you know, down to skin color alone. It's just what are our circumstances? We are more likely to live as Black people, you know, in crowded spaces. We're more likely to live in underprivileged places. Those health inequalities that exist from where we are make us more vulnerable to contracting this infection and to dying from it. So the thing that we need to be cognizant of, you know, is that we are at risk. You know, whether we like it or not, that is, you know, the data tells us that, you know, the population data tells us that we are at risk. What we choose to do about addressing that risk becomes our choices. So if we choose to say that, you know what, I'm not going to take the vaccine, you know, because, you know, the government have been racist to me, and because you know, the government are not, you know, paying reparations for, you know, for Windrush and a number of other issues. That's your choice. You know, you're making a political decision, you're making a personal choice. That remains your choice. I encourage people early on to make a selfish decision. Make a decision that's likely to lead to your survival as an individual. And if you're comfortable with the decision that you've made, whether that's taking the vaccine or not, that's your decision. But be aware of, you know, what the science is telling us. Be aware of what the studies are telling us. And the studies are actually telling us that, you know what, if you have the vaccine, you are going to reduce your chances of being hospitalized by COVID by between 89 and 94%. That's what the facts are telling us. You know, that's what 5.4 million people population study in Scotland is telling us. So what you do with that information about whether you're going to be vaccinated or not becomes your decision. But be sure that your decision serves you, serves your interests. And I think, you know, I keep going back to what, you know, I think it's Angela who said, you know, she would not wish COVID on anyone. Having seen what that did to her son, she wouldn't wish it on anyone. Having seen the effects that COVID had, you know, on a very close colleague who almost died in ICU that I worked with, that did leave a lasting impression on me. So I wouldn't wish that on anyone. The alternative could actually be death, because we know that COVID kills. We know that it's taken 2.5 million lives worldwide. We know that. And because we know that, what we do in terms of protecting ourselves, in terms of protecting our population, is very, very crucial.
Thank you very much. I want to try and finish within my half past. It means that would have been going on a couple of hours. Sandra, you did want to ask a question. Before I come to you though, Marcia and Amadou, is there any new questions that we can finish off with? If not, we'll hear Sandra, and then I'll ask our speakers to make any concluding remarks, and then I'll say something myself, and we'll close. Sandra, you wanted to ask a question.
The last question that I've got here, sorry, Sandra,
yes,
is how many deaths has there been from the vaccine? Does anybody know?
Does anyone know the answer to that question? There was something put on the chat saying that the 170 people died from the chat, but I don't know where the facts are in relation to that. But that was you, Sandra.
Yeah, that was me. I read that on one of these newspapers. It's either the BBC or the Telegraph, but I will go back and find it, because it was saying how many people have contracted COVID and died after taking the first dose of.
Can I just check though, that was that based on an analysis that determined that it was in fact the vaccine that caused their death as opposed to something else?
It was after having the vaccine. That's what.
No, but that doesn't necessarily mean that it was a vaccine that caused their death. It could have been something else. But I'll let the doctor come in on this, because he's the expert on this.
And thank you very much for pointing that out, Clive. What you always have to be careful about is the timing of the death and all the other confounding factors. So if you look at the people who first of all received the vaccine, these were people who were in care homes. These were people who were over a certain age, who probably had long-term conditions, and they probably died from their long-term conditions. And it was a coincidental death which occurred after receiving, the COVID vaccine. So usually, like I said before, you might, if you contract COVID, say today, and then you receive the vaccine tomorrow, the vaccine is not going to protect you from COVID. And if you then subsequently die of COVID, it's not because of the vaccine, it's because you contracted COVID. So even when you look at the protection, even all of the data that we look at, after you've received, the vaccine after about 2 weeks, that's when it starts to become, that's where you start to build up the immunity. That's when you can sort of safely say whether or not, COVID has actually prevented someone from the vaccine has actually prevented someone from contacting the virus or not. There have been a number of, coincidental deaths that have happened, and sometimes, newspapers, may not have done the proper analysis before publishing their information. So we'd want to see published data, which I don't have with me at the moment. But I'm sure to get that for you if you need it.
I would say that one of the things that we have to be careful is about statistics, because actually statistics raises more questions quite often than the answers that they provide. For example, somebody circulated something I've seen just recently saying that a number of women in the US have aborted, their children have been aborted because they've had a vaccine. Actually, there was no evidence that was provided within that to say, actually, there weren't other things that was happening in those women's life that would have caused them to have aborted a child. And I think we've got to be careful about some of the information that we do share, because just because you say 23 women that were pregnant and incidentally had the vaccine and therefore lost their child, doesn't actually automatically equate to that the vaccine was the cause of that. And I think there's a similar situation with these numbers, that people don't always explain the numbers. And that's how we get a lot of misinformation circulating around. Was there anyone wanted to ask any final desperate questions? If not,
sorry, I'd like to add a bit of a statistic, please, just very quickly. I know 11 people who've contracted COVID-19 and 11 have recovered. Thank you.
Excellent. Thank you. Sorry.
Can I just say something? Because I think it was Mimi that asked a question about the immunity. The doctor said earlier that 33% of the population has had the vaccine, and we need to have 90% before we have herd immunity. And the lady said, well, if Black people are less than 10% of the population, why is the push so hard for us to have the vaccine when there's more people at the other end of things that could be taken a vaccine?
You know, there's more white people, in other words.
Yeah. Well, non-Black people.
Yeah, okay. And your point is?
My point is, if that's the case, then why are they pushing us as the BAME group?
Well, what I would say personally.
Sorry, because every day you're hearing on the TV, we need more Black people to take the vaccine. We need more Black people to take the vaccine. But if you need 90% for herd immunity, why not push, you know, the white people to go forward, and so that we can reach the 90%?
My simple response to that would be, in that time, we might have disappeared whilst we're waiting for the herd immunity to occur in the other community, because what we do know is that we're more likely to die having caught the vaccine. And when are we going to arrive at that position? So I think that would be, I don't think we need a medical response. I think that's it. I think we have to think about these things seriously.
That's a feeble excuse, because enough of them have it, we won't be needing it the way they keep pushing it. I agree.
Exactly.
So your excuse, Clive, is a bit slim. It's not washing with me.
Let me get a medical opinion.
In my statistics, all 11 were Black people. I know them personally because I'm related to them.
Okay, let me come in on that. So thank you very much.
You better come good, doctor.
That remains to be seen, Marlene. That remains to be seen. So the truth of the matter is, Mimi, that the majority of people who actually contract COVID recover from it. Yeah. So that's the first point that I'll make. So the people who the majority of people who contract COVID recover from it, okay? The difference is, right, COVID, unlike, you know, your seasonal flu, has claimed 2.5 million lives globally. 125,000 people have actually died from COVID in this country. So we do know that it can be a fatal condition. What we also know is that people who are clinically extremely vulnerable, people who have got those long-term conditions, you know, that I mentioned before, are more likely to die from it than people who are not. So the people who are more likely, or who are overrepresented in that clinically extremely vulnerable group, tend to be people of our skin color, and people who are living in, you know, less privileged, you know, parts of the society. The interesting fact is, if you compare, you know, vaccine hesitancy between, you know, the Caucasian population and the BAME population, you will find that naturally the people of a Caucasian background are less hesitant. So 80% of them. That's not to say that every single white person in this country is not hesitant about the vaccine. So almost 80% of, you know, people of a Caucasian background are more likely to just say, I'm going to get the vaccine. They're queuing up for it. You know, that's the reality of the situation, compared to about 56% on average of people in the BAME community. Now, if you know that when you start a vaccination program, the people that you need to make sure you protect first of all are the people who are most likely to die. So the number needed to vaccinate people who are over 80 is in order to prevent death is 20. The number of people needed to vaccinate in order to prevent death in someone who is 50 years, in the people who are in their 50s, is about 800. So when you're looking at where do you want to vaccinate first and who do you want to offer a vaccination to first, you want to target the people who are more likely to die. So this is one of the things that, you know, the government has been celebrating recently, is the percentage of people in the over 80s, you know, cohort that they've managed to vaccinate. So they actually consider it to be an achievement to have vaccinated the most vulnerable group of people. In the second cohort, we looked at people who were clinically extremely vulnerable, and that was not about whether or not those people were black or white. That was based on people having long-term conditions. And those people who got those come and get your jab letters, the timing of when they got those come and get your jab letters was based on whether they were a priority. So that doesn't, you know, it's not based on, you know, their ethnicity. It's actually based on their vulnerability of death if they did contract COVID. So if you find that you're receiving those letters, the reason why you're receiving those letters is because you fall into that, you know, hierarchical cohorting structure. So if you're over 80, everybody has received that letter. If you're over 70 by now, everybody has received that letter. If you are in the clinically extremely vulnerable group, where you've got diabetes, whether you've got, your immune system is suppressed in any way, whether you've got cancer, whether you've got this, whether you've got that, you are going to receive that letter based on you being in that cohort.
Okay, thanks very much. I'm going to give the final question to Amadou before I just make a comment and then ask people to round up. Amadou, you wanted to comment?
1 minute, sorry.
No,
Clive.
so Marlene, you've already been in. Amadou hasn't said anything.
I just wanted to say something to the doctor.
Sorry, Marlene, hang on a second. I think we do want to hear different voices. I will, let's Amadou come in first, and then if it's a brief point, we'll hear what you got to say. Amadou.
Okay.
Clive, mine is just a quick point here, please. And I'm just saying statistics does not do color or race, okay? And secondly, I know people in Africa that have fallen to this virus. So please, let us, I have a friend from Zimbabwe who lost 4 members of his family within 4 weeks. So if we're thinking it's an experimentation or the underlying issues, I think we should look beyond that. If we are looking at this through the color prism, we're missing a point. That's all I have to say, really.
Thanks, Amadou. Marlene, you say it's a quick point.
Right, yeah. Well, doctor, you've covered your point. If you say people, 80% of the whites are queuing up to get the vaccine and 50% of the blacks are getting it, we've got the herd immunity that will exist. So what is this? There is still this big push for black people in particular, you know, because we are this tiny percentage and they are all queuing up for it. So they will cover the herd immunity that is needed.
Okay. So I'm hearing what you're saying.
I don't understand this. So if the white people get the immunity, then the black people won't need to get it. They won't get COVID. Is that what you're saying?
No, that's not what I'm saying. So
no, that's not.
No. I'm
That's not what I'm saying either. The doctor know what I'm saying, so he's going to answer it.
Okay. So if we look at that, all right, just on a simple, stats. That will give us an average of about 60 to 70% of the population getting the vaccine. That falls below the 90% that we need to get the herd immunity. and that increases the risk of the virus mutating into the strains which are more resistant to the vaccine. So the idea is to hit that 90% target, and it's a whole wide population effort. It's not just saying, oh, I'm going to wait until so and so from next door gets the vaccine. I'm not going to bother, because if he gets the vaccine, then then I'm going to be protected. That's not the case. The second thing to remember is that it's about that, who is most at risk of dying from COVID, who needs to take the vaccine. So even if we've vaccinated, people who are less likely to, to succumb by death from COVID, that still leaves those who have got the potential of dying from it not protected. And those are the people that we're trying to protect. And the people that we're trying to protect, and the reason why I'm here today, is because I care enough about the Black community, because I'm part of it. I'm only here because, I am one of you. And it would be a real shame, if my brothers and sisters were to die of COVID when we've got something that could save them.
Let me ask a question, please.
Okay,
Can I ask
thank you, Doctor. Sorry. I'm good. I think we're going to conclude, because it actually looks like we could carry on all night with this
Sorry,
conversation.
before you conclude, could I just quickly say, the doctor mentioned earlier that it's not due to the color of your skin, really. What the people who are most vulnerable are those with underlying conditions. Is that correct? He mentioned diabetes and a few other illnesses. So why doesn't the government stand up there and encourage those people with underlying conditions to come forward and get the vaccine? Why target people based on the color of their skin?
Because the people who are most at risk of having those underlying conditions are from a Black, Asian, and ethnic minority.
I don't believe that with the majority of people in this country being Caucasian, European, you can't tell me that the majority of the illnesses that visit the doctor or the number of people taking medication in this country is due to Black people or African descendants. That's not true, because I work in industry where I'm very exposed to the public, and I meet people, hundreds and hundreds of people on a weekly basis. And to be honest with you, 9 out of 10 white people who come to see me, they've got some illness.
Okay.
They are not of they don't have a good health status. So I don't believe that Black people are more vulnerable than
Mimi, I think that's a debate that we're never going to get to the end of, because then people will clearly have different opinions around this. What I would say is that there's this issue that we talk about as an organization about helping ourselves, self-help. And I'm surprised that we're having a conversation like this and we're thinking that we should leave our well-being to other people to determine whether we're well or not. I'm somebody who's, I haven't said this, but I'll say it now. I'm somebody who have had the first dose of the vaccine, and it wasn't without consideration. I actually heard all of the stuff that was going on at the beginning about the speed of the research around this, and the historical stuff that I knew about where we've actually been discriminated against and we have been abused medically over the years. But when it came down to it, I had to ask myself the question, having somebody who haven't had dengue fever only about 14 months ago and had to be hospitalized because of that. And I started imagining and seeing the impact that this coronavirus has been having on people. And I literally had to start thinking about, well, what about my family, and what can I do to ensure that I can protect myself? I was born in Jamaica. I still go to Jamaica, and I actually want to be able to travel. I think what we have to do is that we have to think about all of these things ourselves. My neighbor, who is from a BAME background, died within a week of going into hospital catching COVID. I think that when I talk, and I have to say the work that I do, I come into contact with a lot of colleagues some of whom are actually having contracted COVID back in March, April last year, are now suffering seriously as they complain all the time about long COVID and the impact that is having. I had a vaccine and I had no reaction whatsoever to it, but I do know a number of people have had varying type of reactions. It's like a spectrum. Some people have more, some people have less. But I think what we have to think about ultimately is what is in our long-term best interests as an individual, but also in terms of a community. So I took a decision, and I think we all have to take a decision ourselves. And I think this conversation is about helping us to take an informed view of that. So I'm now going to ask our speakers in reverse order to spend no more than 30 seconds, because we've spent too much time on this, to give us the last word. So I'm going to go as I did previously. Sandra, your last word in less than 30 seconds.
Less than 30 seconds. I'm not convinced I'm going to be rushing to my doctor's tomorrow to take the vaccine. I will wait and then see how it goes, but I'm not there tomorrow. I haven't got a letter and I'm in my 50s.
Thank you, Sandra. Thanks for joining in. Angela, you're next. Are you still with us, Angela? You're muted if you are.
I can't see her.
Okay, Angela may have left us, but I think she made a powerful message in the first place. Ethel, do you want to have a final word?
Thanks, Clive. Yes, just to say thanks for such a rich conversation tonight, and thanks for the honesty and transparency. And people were really open and honest about their position, which is great. And remember, no one is coercing you, but what we're trying to get at is make a decision in your best interest based on factual information, not on what's being thrown around on social media or statistics that are being thrown around, but look at the information. Is it factual? So I would say your go-to place is NHS England website. It's got all the up-to-date information on everything you need to know about the vaccine, numbers, and everything else. So yeah, so make an informed decision. Thank you. Thanks, Clive.
And thank you, Ethel. And she's obviously an example of a Black person who is actually there looking at these things too. Mohsen, final word from you.
I just want to say how beautiful it is for me to have spent the last few hours of this evening with all of you. And I think one of the positive things that's come out of the pandemic is the new ways of working, is our better use of IT systems, where we're all in different places tonight, but we can come together. And also for whatever you can say about the push about and the BAME people coming into light, it just means that it has supported us with coming together as well to have conversations that we probably weren't having before. And I just want to say that we should make sure this doesn't end with the pandemic, and we should continue to come together to talk about issues that matter to us as Black and Black African and Caribbean people. So lovely meeting all of you. Thank you.
Thank you, Mohsen. And finally, Dr. Atai, I know we've put a lot of load on you tonight, but would you like to conclude, please?
No, I think I just wanted to thank everyone for that really stimulating debate that we've just had. It's good to be able to talk about these issues, to be frank with each other, and to share information. I think it's all about sharing information. It's all about listening to concerns that people have, and it's all about just allowing people to make an informed choice about what they want to do. I think there's some questions which I might send some data to yourself, Clive. I put in the chat about the whole long-term conditions. I think I could share that with you, and you could share with your colleagues who are around the table in terms of what that's based on. That might be useful for people, it might not, but I just think it's all about making your decision and doing what's right for you. Thank you very much for actually listening. I think that's really good. That's very useful, and long may these sort of debates continue. Cheers.
Thank you very much, Dr. Atai. And a couple of things. Mohsen did ask about the Watford African Caribbean Association, for which I chair. We cover Watford and the surrounding areas. And if you believe you live in the surrounding areas, I'll put in the chat our details. Just contact us on it's hello@wacas.org.uk. It's in the chat. It is an organization that if you live in the area, you should be a member of. There's no excuse for you not to do that up to tonight. Just to say, one of the things that we're also doing on the 14th of this month, we're having a session looking at the census, because actually our concern as an organization is in the well-being of our African and Caribbean communities. And the census is coming up on the 21st of March. And actually, we need to be counted because actually what often happens is that people underestimate the number of us that is there, and the services that we have access to is based on the numbers that we represent. So if you'd like to engage in that, then let us know. We can send you the information in relation to that, so you can join that discussion as a Sunday evening. As I say, the organization is here, and it's your organization, and we're here to we see ourselves as the village, and of course the village looks after itself, and that is probably as much as I need to say about that. I just want to thank all of our speakers this evening: Sandra, Angela, Ethel, Mohsen, Dr. Itai. Thank you very much. I think it shows that our motto actually is together we can achieve, and I think this is an indication of us living our motto tonight. Most importantly, though, I want to thank all of you for joining in this evening, because actually you've made this occasion what it has been. So thank you very much, and if you want to keep in touch with us, we'll keep in touch with you about the different things that are going on. So thanks again, and have a very good evening tonight. Thank you.
Thank you. Good night.
Thanks, Clive, and thanks to everyone as well.
Thank you, Clive.
Thank you,
Bye.
everyone.
Thank you, Clive.
Bye.
Very interesting.
Thank
Thank
you.
you.
Bye-bye.
Clive. Clive,
Yes.
this is not usually the forum for it. Oh, there she is. I was going to say it was so lovely to see Esther. Haven't seen you for ages, and I was going to ask you to pass my best wishes on. But there you are. Good to see you, Esther.
Hello,
Take
yes,
care.
I'm there. I'm still there.
Yeah, I'd love to get in touch and speak.
Yes.
I'm going to stop recording now, sir.